borderline deficiencies or known as subclinical hypothyroidism. So if this is not recognized, then hypothyroidism will not be corrected. This is the biggest hurdle for doctors to get patients to get the treatment, because doctors refer to reference ranges. So what do we mean by correcting borderline deficiency is this. If you look at the lab reference range is always very wide. Like for example, the lab that I do Gribbles, the reference range of free T4 is 9 to 25. Okay, so the range is very wide. Up from 9 to 25, it's deemed normal. Anything above 29 is hyperthyroidism. Anything below is hypothyroidism. And similarly, for free T3 is 3.5 to 6.5. Anything above and below is considered as abnormal. Anything within is still normal, irrespective of the symptoms you have, the complaints you have. And I also mentioned that if you persist in complaining, you're always very persistent, you're always complaining to the doctors, we might be labeled wrongly also. So, but the problem lies here, because 95% of the population will lie within the reference range. So this does not define optimum health. When we talk about functional medicine or integrative medicine, we always talk about optimum health. Now, optimum health means, as far as vitamins and minerals and hormones are concerned, you must be at the optimal range, not the reference range given by the labs, or not the limit set by daily recommended allowance. So what is optimum for hormones? Most hormones, not all the hormones. This needs understanding. As far as thyroid hormone is concerned, the optimum is 75% of the upper limit, which means you take 25 for free T4 and 6.5 for free T3, and you take 75% of that. So when you take 75% of that, then that becomes your optimum. Anything below, it's hypothyroidism. So we name it as subclinical or borderline hypothyroidism, because it's within the reference range, but you have all the symptoms. And this must be recognized and this must be corrected. And I hope I'm making it clear, especially to non-doctors, because you have to find a doctor who will understand this and a doctor who accepts this and correct your hypothyroidism, because it can have a lot of health consequences. So correct borderline deficiencies for optimal health before and during pregnancy is as important as always, because you need to help in a healthier generation. So if hypothyroidism exists before pregnancy or during pregnancy, it can affect the next generations. So it's very important to understand this. It is not untrue to say that a lot of our adult diseases actually have fetal origin. So if one big example is low thyroid hormone during pregnancy, if the maternal or the mother's thyroid hormones are low, it affects the fetal health in many ways. I'll go through. So that can actually predispose to adult onset diseases, because you have already started the origin of the disease in utero at the time of conception and during development. So the alterations in the fetal nutrition and endocrine status, that means hormones, influences the developmental adaptations that can cause permanent changes in structure, physiology, and metabolism, as well as predisposing individuals to cardiovascular, metabolic, and endocrine diseases in adult life. Now, please understand, that's why I wanted to talk about this through different spectrums of life. Most research has identified clear links between developmental origins and diseases like coronary artery disease, obesity, diabetes, osteoporosis, sarcopenia, and many others. So if you want a healthy generation, you have to work backwards, before and during pregnancy as well. So we go through the hypothyroidism in adults, which I've already presented earlier, just to re-emphasize, so for better understanding, especially for non-doctors. Our body functions optimally at 98.6. Why? Because many of the bodily functions and biochemical reactions in the body happens by activation of enzymes, like you have digestive enzymes, for example. So if your digestive enzymes are not working well, or they are not active, then you don't digest your food. I'm just giving you one example. So if the temperature is lower, then the enzymes do not function normally. So enzyme dysfunction starts if the body temperature drops below 98.2. You can always use a simple thermometer to check, but then you have to do at least 10 times a day and average it up. Why is it important? So why does your temperature drop below 98.2? Is because your metabolism is low. Why is your metabolism low? The commonest reason is still low thyroid hormone or hypothyroidism. So hypothyroidism affects enzyme function. So if you look at someone who is hypothyroid, they'll have poor digestion resulting in bloating and swollen tummy. That's one reason. So it can present even in many ways. If we understand what thyroid hormones do to us, you will understand the different presentations it has. So it's one example. The other examples are, of course, you can have degenerative diseases, multi-organ diseases, suppressed immune system. Now, a classical example is in children. Hypothyroid children are often sick with cough and flu and fever and tonsillitis, immune dysfunction. But unfortunately, they are treated often with antibiotics, and they develop fungal infection or candidiasis, which will present in future exactly like the flu, and they'll be given more antibiotics. That's why the children get frequently sick. But of course, a dysfunctional immune system can also predispose one to allergies, bacteria, fungal, viral infections, and many more. And low thyroid hormone can present as fibromyalgia, which means aches and pains, especially in the muscles, and chronic fatigue syndrome. Lethargy and fatigue is one of the commonest features of hypothyroidism, especially morning. In the morning, you drag yourself out of the bed, you are tired in the morning, and you can have stiffness of joints in the morning. You can even have stiffness of the fingers and numbness in the fingers. All these are presentations of low thyroid hormone. So fibromyalgia simply means a pain in all over the body, especially the muscles, and there'll be a lot of tender points. Chronic fatigue syndrome is what CFS stands for. Okay. And other symptoms will be circulation symptoms. This is the reason why, if you look at hypothyroid patients, it's very easy to diagnose. Look at them, they'll have the sallow appearance. So because of the poor circulation, they'll have cold intolerance, and they have cold hands and cold feet, very classical. If you are a doctor who will touch the patient's hands, if they allow you to, but of course, I felt embarrassed a few times when patients don't want to shake your hands. So if you are able to, the first thing you'll notice is they have cold hands and cold feet. Then you can go on and asking them about all other symptoms of hypothyroidism, and many of those will be present. And the palms will be pale and yellowish. The reason for yellowish palms is, I mentioned before, they do not convert carotene to vitamin A. So the carotene stays in the body instead of becoming vitamin A. So that, carotene is yellow in color, like carrots. So that's the reason why they have yellowish feet and palms. And muscle pain, especially in the morning, is a classical symptom as well. Energy, as I mentioned, morning lethargy is very, very classical. They can feel fatigued and they can have decreased exercise tolerance. Now, this contradicts what I told earlier. I'll explain, because hypothyroidism is a condition where exercise gives them more energy. If they don't exercise, they feel always tired. And these are people who are, obsessed with exercise. They must exercise, even wake up at 4 o'clock to jog. This is typical of hypothyroidism. But some patients, because of the inability to sweat well, they can have decreased exercise tolerance, and also they feel heat intolerance, although they have cold intolerance. These are symptoms because their inability to sweat well. If you ask them, hypothyroid patients, classically, they'll say they sweat less with exercise. This is how it looks, normal, yellowish. This is very typical. This is late stage of hypothyroidism. Yeah. But of course, if you want more diagnosis, you can see these creases are very dark. This is another hormone called cortisol, anti-stress hormone that's low. But if you look at the eminence here, we call it Tina eminence. This is all dropped and sagging. This is low growth hormone. So you can see darkening. So this is multi-hormone deficiency. And here you can see the wastage. This is protein loss. Could be because of low protein intake, could be because of low testosterone, which is the male hormone. More signs in the morning, especially if you look at them, they'll be puffy, face appears puffy, and they'll have eye bags, another classical sign. And there is generalized swelling, which can present as swollen and bloated belly, thick and swollen cuffs. I just took a picture of my hiking partner. He has hypothyroidism. So he's another classical example who must go for hiking even on Sundays. He doesn't rest unless it rains. And his gait is a little bit wobbly, he's obese, but he has lost a lot of weight. Just through hiking, he also managed to reverse his diabetes and hypertension. So if I wanted to show you the cuffs, they'll be thick cuffs. And there can be edema, which doesn't dent. So it's called non-pitting edema. So this actually, in medical terms, is called myxedema. And the same swelling or myxedema in the hands, palms, is the reason why they also get tingling and pain and numbness in the fingers, because the nerves get compressed. So this is a headmaster, and he came to me with main problem of pain in the plantar sole of the feet, especially in the morning. So he had, of course, all the signs of hypothyroidism, lethargy, numbness, pain in the fingers. Now look at the thyroid hormone. I mentioned to you that 9 to 25 is range. 75% of the 25, around 22.5 is optimum. Only 1.3 extremely low, and TSH, which should be below 2, is more than 100. So this is an extreme case of hypothyroidism. And the moment you correct the thyroid hormones, they'll feel so well and they'll be very grateful. And this is, of course, myxedema, the swollen face. And once you correct, the face is this. Other symptoms, classical symptoms will be obesity, excess weight, and this patient, hypothyroid patients, will always have difficulty in losing weight despite exercise and healthy diet. So very classical presentation. Patients can have, especially ladies, can have cellulite. Other symptoms, bradycardia or low heart rate. If this is not diagnosed, then it will be treated, and sometimes even pacemakers when the heart rate is very low. Decreased myocardial contractility means the heart's ability to pump blood will be decreased. So you have circulatory problems and you can also have low blood pressure. Atherosclerosis, we all know, and one of the reasons is low thyroid hormones. And so don't blame the cholesterol. Sluggish organs. So all organs will be sluggish. So slow organs, slow metabolism, sluggish organs are all classical symptoms of hypothyroidism. So as far as the brain is concerned, anything in red is common. You can have apathy, you are not interested, always sleepy, decreased memory and concentration. Depression can be very common in hypothyroid patients, slow thinking. So they are poor performers. Even as employees, hypothyroid employees are poor performers. So you have a KPI for them, they don't meet the KPI often. So as if you are the leader, then it's good for you to know if somebody is slow, you better get them checked, have them check their thyroid hormones. Irritable, nervousness, and poor concentration are often associated with low cortisol hormone, which comes from the adrenal gland, which is just above the kidney. And they usually coexist, low cortisol and low thyroid hormones. Diffuse headaches and migraines are common presentation. You can have sluggishness in the muscles and joints, giving rise to joint pains, muscle pains, as well as compression, nerve compression. This is also a sign for which, if you do not recognize, unnecessary surgery will be done. So this I presented the previous time. This is a patient of mine. I saw her during pregnancy, but she had already done a surgery on the left hand. The medical condition is known as carpal tunnel syndrome. So we believe that the nerve here called ulnar nerve is compressed, and that's the reason why you have. But we never think about what causes the compression. I told you the philosophy of medical treatment should be always treat the root cause. So if you don't recognize it, it will end up like her. So she had a surgery to release this tendon. Tendon is not at fault. The nerve is not at fault. It is just the compression due to myxedema or water retention, which happens in hypothyroidism. So when I corrected the hypothyroidism, when she had the similar symptoms on her right hand during pregnancy, and when I corrected the hypothyroidism, all the symptoms disappeared. So you can avoid a surgery. You can even avoid pacemakers if you understand this. Women, please pay attention. You can have scanty menses, a classical symptom of low thyroid hormone. You can have irregular cycles, usually delayed cycles, 2-3 months once. You can also have frequent cycles or frequent and heavy cycles. It can present in many ways, but the classical one will be scanty flow, less flow, and for shorter days, and you get your menses maybe 2-3 months once. Sometimes because of congestion, you can also have heavy and painful period, that is dysmenorrhea. Heavy menses is menorrhagia. Premenstrual syndrome or PMS can be present in hypothyroidism. So this is important to recognize. Now, why I'm saying this, very often women are prescribed with contraceptive pills to correct this problem. That is a cruelty if you ask me, because they are synthetic hormones. They have so much of side effects. Try not to touch them if possible. And if you understand again the root cause, you can fix many of these diseases. So scanty flow, cycles, shorter cycles, irregular and often delayed cycles are classical presentations of hypothyroidism. And this can start from teenage onwards. So once they have menarche, the first menses, after that girls can have this problem. So it's better to recognize, because if you don't recognize this problem, it will end up with infertility and pregnancy losses. I'll show you. Sweat glands, I mentioned that a classical sign of hypothyroidism is less sweating with exercise and reduced heat intolerance, as I explained. Hair, there will be dryness, there can be split ends and cracked dryness on the scalp. Hair loss, diffuse hair loss. I have some slides. And you can also have rough follicular skin, we call it. Okay, this is diffuse hair loss, classical of hypothyroidism. Hair recession early, she is very young. And if you notice this is the normal eyebrow. You can see it's all getting less. Now, I did ask her because sometimes they remove it. This one is not the case. So this is loss outer 1/3 of eyebrow. Usually the loss of hair in this area is also a sign of hypothyroidism. This is congestion. You can see how the legs are congested because of water retention. Dry, cracked feet, sign of hypothyroidism, as well as omega-3 vitamin E deficiency, sometimes omega-6 as well, follicular skin. If you just run your hand, it will be rough. You can have fat depositions called xanthomas. We say it's all cholesterol very often. Many people say this is cholesterol deficits. High cholesterol itself is a sign of hypothyroidism. So these are xanthomas. So again, we shouldn't be blaming cholesterol. So you can have low or dysfunctional immune system resulting in frequent infections, I mentioned, and allergies. Infertility is a very common problem. Unfortunately, if this is not recognized, women are treated with fertility pills and even IVF. I'm not against the treatment. All I'm saying is correct the underlying problem. Spontaneous pregnancy is very much possible. And even if IVF becomes successful with hypothyroidism, you will have a high chance of pregnancy losses. So sometimes you have unusual presentation. I mentioned about bradycardia, and if you don't recognize, you may end up with pacemaker. You can have valve prolapse, and you can have a valve replacement if this is not recognized. Heart valve prolapse. Difficulty in swallowing. Patients can have difficulty in swallowing supplements. Another unusual sign. This is, over the years, I realized that these are the unusual presentations because when I correct problems mostly improve. Frequent and increased urine output. They drink, they pass urine. They can't go, they just pass urine. But because they have a lot of urine output, they also feel very thirsty. So they keep drinking and they'll tell you that they just can't keep the water in their body. That's another presentation. Excessive thirst, difficulty in drawing blood for patients with hypothyroidism. Doctors will have difficulty because when you're cold, it's very difficult to see the veins. I mentioned to you about reference values. As doctors, understand the borderline or subclinical hypothyroidism, and please treat. What we have learned in medical school is not correct. So, of course, if you keep bothering the doctor, if they don't understand, that you will be labeled that, you all have it in your head. So there will be a lot of prescription drugs for various things that we consider as your problem instead of hypothyroidism. That's the reason why I'm explaining this, so doctors also can understand. I think this I've already explained, so this we can skip. Okay, this is 2012 to 2014. This is the number of cases I tested. Now look at actually the number of cases that I treat for hypothyroidism, my patients, at least 90%, including at least 90% of pregnant women. You'll be surprised. And most of them, almost all of them, will feel much better with treatment. But if you follow the reference range, look at this number. 1256 cases. The free T4 below the reference range, there were only 9 patients. So if I didn't correct if I corrected according to the reference range, majority would not have been treated. Free T3 below reference range, there were only 11. And TSH more than 8, more than 2, there were 348 patients. So TSH alone is not good enough for diagnosis. You should not follow the reference range. In 2015, 297 cases, again, below the reference range, there are very few. It's better to understand this for doctors and treat the patients, not just the value. You have to consider the symptoms of the patients. 2016 to 2021, 1,601 cases. Below reference range is mostly seen in very sick patients and cancer patients in ICU and very sick. So I just go through very quickly. 64 years old, patient with cancer. You look at free T4, just above the lower end of the reference range. Free T3, this is very common, below the reference range. In sick people, very sick people, T3 is usually below reference range. And TSH, of course, is very high. It should be below 2. 57 cancer patients, free T4 just above reference range. T3 again very low, and TSH is normal. So TSH is not the optimal way of diagnosing. 56 and cancer, T4 is just above normal. T3 is below reference range. So T3 is a better indicator of health and disease. 71, free T4 is 10.4. T3 again is below reference range. So you can see how hypothyroidism influences cancer, because if you have immune dysfunction, you are prone for viral infections, you are prone for allergies, fungal, bacterial infections, and cancers, and a host of other problems. So if anyone doctor is treating cancer patients, it's always better to consider hormones as well. And low thyroid hormone plays a significant role in maybe initiating and progression of cancer. Another way that hypothyroidism influences cancer is this. I mentioned this, that there is a master switch in our body called AMPK. Now, as we age, the activity of AMPK drops. And this is why some of us, we take AMPK as a supplement. Whereas there is another cell signaling molecule, mTOR, that goes up. Now, AMPK reduces cancer and increases metabolism. So it reduces risk of diabetes and a host of problems. mTOR increases the risk of cancer. So if you have hypothyroidism, then your AMPK is suppressed. So that actually can increase the risk of cancer. So this hypothyroidism and pregnancy, this is my special interest. Maternal hypothyroidism. Very interesting, but if we do not recognize and treat, I think we are doing a big injustice. So it's also very important for obstetricians and gynecologists. Unfortunately, it's rarely recognized and rarely treated because we still stick to the reference range, but it increases pregnancy losses. There a definite increase in miscarriages, spontaneous abortions, and premature deliveries. If hypothyroidism is not corrected, imagine a child is born premature, ends up with ventilators in ICU, antibiotics and x-rays, and can you imagine what it does to the baby? Whereas if you correct, then you prevent premature delivery. Of course, there are other causes, but this plays a very big role. Children who are born to hypothyroid parents will go through, they have poor school performance and many other problems. But at birth, they can have jaundice. I have some slides. But the problem with them is that they also have spinal deformities. And if you have a spinal deformity like kyphosis and scoliosis, you know that it affects your posture and health. Spinal posture is very important for health, especially as you age, it can affect you, even your breathing. So prenatal and antenatal, before pregnancy and during pregnancy, correction of clinical and subclinical. Clinical is what we know. It must be below the reference range. And subclinical is what I told you, is critical because it affects the health of the next generation. Treating even mild subclinical hypothyroidism improves fertility. So anyone who's having problems with conception, one of the very, very important tests you should do is to check your thyroid hormones. And as well as, of course, you should check your insulin. And there is a test, another test called homocysteine. These are all tests that usually not done, or at least if they do thyroid, there's often that is just free T4, not free T3 and TSH. Of course, correction will improve pregnancy outcomes. Definitely, you'll see as an obstetrician, I have always noticed this. Less problems with the newborn. Improves intelligence and immune health in the children. Very important to realize this. And improves lactation. If a mother has poor lactation, think about hypothyroidism. Don't just advise bottle. Think about hypothyroidism because it's going to affect the next pregnancy of her mother's health. But of course, nowadays, many mothers have substitute pseudo mothers to breastfeed. Those are, wonderful cows that we have artificially induced to keep them lactating 365 days, 24 hours a day, and until they are slaughtered. So I call them pseudo mothers. And I wish there is a day when all these pseudo mothers come crying to collect their babies back home, because they are the ones who are feeding the baby now, not the mothers. Sorry to say. So hypothyroidism in pregnancy, again, to remind you, miscarriages, premature deliveries, sudden intrauterine death. You would have come across, I'm sure some of us would have heard, that the baby suddenly died inside, and we have no cause. Of course, it's a genetic test for both the parents, and we don't find any reason. So we say, we don't know why it has happened, and take care in the next pregnancy. Please consider low thyroid hormone if the baby has sudden death inside the uterus. Postnatal depression. Consider hypothyroidism and omega-3, as well as progesterone rather than antidepressants. Vitamin D3 deficiency is also very important to prevent and treat depression. There can be increased risk of anemia and also hypertension in pregnancy. It's called preeclampsia. Abruptio placenta is a very serious but fortunately rare complication where the placenta separates from the uterus before delivery. So this is a very dangerous complication for both the mother and the fetus. And the mother can also have excessive bleeding, which is called postpartum hemorrhage or PPH. Pregnant women with hypothyroidism can have post-dated pregnancy, which means pregnancy that stretches beyond 42 weeks. And actually, the stimulus for delivery, actually, onset of labor pain, we know it comes from the fetus. And if the mother is hypothyroid, then obviously there is fetal hypothyroidism. So the signal will be delayed. That's the reason why the pregnancy is post-dated. And for obstetricians and gynecologists, even for general practitioners, if you are treating antenatal patients, please understand the first one I've mentioned, There is macrosomia, that means big babies. I'll show you some slides. Sometimes that you can have small for dates, small babies. Neonatal jaundice and breathing problems at birth, often known as respiratory distress syndrome, RDS. But the diagnosis is usually because of congenital pneumonia. And in my opinion, it's hypothyroidism. When you're hypothyroid, there is lethargy, there is less energy. So the same thing happens to the fetus, and the fetus will not breathe well. So when there is shallow breathing because of less energy, of course, you'll have low oxygen levels. It's not because of infection. Childhood infections, allergies, asthma, ADHD, autism, dyslexia, a lot of problems associated with maternal hypothyroidism and slow milestones. So if you have a child, and if pediatricians recognize this, then it will help in a big way, because they will then check the mother, ask the mother to check. And if she checks and corrects, at least the future pregnancies will be much healthier and the outcome will be better. If not, it's good for public to understand, at least. Now, hypothyroidism at birth, how it presents. Thyroid hormone is very important for fetal growth. Low thyroid hormone can result in big baby, not because there is the baby is big with muscles, and no, actually because of more fat and water retention. Now, it's very important to recognize the trigger for development of organs in early pregnancy depends on maternal thyroid hormone in a very big way. Okay. So that actually especially involves the brain as well as some tissues in the body. Like if a baby is born with, we call it congenital anomalies, especially with these tracts, the esophagus, which is a tract from mouth to the stomach, and the trachea, which is from the mouth to, of course, lungs. These are the problems. Poor development in the intestines, and the stomach is poorly developed, kidney is poorly developed. These congenital anomalies, because of hypothyroidism, because the trigger for early development comes from maternal thyroid hormone. And the other one is when organs are developing in the fetus, the final stage of differentiation to become a fully functional organ depends on mother's thyroid hormones. So if the mother is hypothyroid, this differentiation or further development is affected. Again, the baby will be born with congenital anomalies. If this is what happens, and if you stretch it further, you will begin to wonder whether babies born with a hole in the heart also could be because of this. But it's definitely worth investigating the mother if you have a baby with congenital anomalies. And survival at birth, thyroid hormones play a very critical role, because they help with oxygen exchange in the lungs. So if you have less thyroid hormone, then of course the breathing effort will be less and the exchange of oxygen will be slow. And so the baby will become hypoxic, and the baby will not be able to regulate the temperature. So that is known as thermogenesis. So they'll become cold, and cold babies will have more problems with breathing. And thyroid hormone is important to keep the glycogen level. Glycogen is a storage form of glucose that's in the liver. When you are fasting, that's how you get your sugar in the blood. So if low thyroid hormones, less glycogen in the liver, so that means after birth, when the mother's supply of glucose is taken off, and before the next feed, the baby depends on the glycogen in the liver. So if the mother is low in thyroid hormone, the baby will have hypoglycemia or low blood sugar. Okay. And also for cardiac adaptation, that means the pumping effort of the blood, the heart. So even mild and borderline hypothyroidism affects fetal organ development. So it can result in congenital anomalies. And remember, the only source for thyroid hormone in the baby fetus during the first trimester or the first 3 months is the mother. And we need to understand, I can emphasize again that the endocrine system, that means the organs that secrete hormones, start in the embryo itself at this age, not at this stage, much earlier, because once conception has taken place, the embryo will start developing fast into organs. And that is the stage that hormones are required, thyroid hormones. But it's optimum if the mother has thyroid hormone, adequate thyroid hormone before pregnancy. So fetal health depends on mother's health. So it depends on hormones, it depends on nutrition, depends on stress, environment and toxins, exercise, physical activity, sleep, the use of handphones and computers a lot at night. So everything has to be considered and not just doing a 3D or 4D ultrasound only. Okay. So listen to this very carefully for ladies and doctors. Fetal thyroid hormone, the thyroid hormone for the fetus, is exclusively, almost exclusively from the mother in the first 3 months of pregnancy. That's called the first trimester. And this is when organs start to develop and mature. And relative iodine deficiency is also critical at this time because it happens. The reason is because a mother could become, if she's already low in iodine, and she can become, the deficiency could get worse because there is increased loss in the urine during pregnancy. But a compensation is that there are hormones like estrogen and HCG, which comes from the placenta, human chorionic gonadotrophin. They stimulate the TSH, which comes from the pituitary gland, to produce more thyroid hormone. But if the mother is not able to produce enough thyroid hormone, which is known as hypothyroidism, of course, it will even affect the development of organs in the fetus. And the first trimester is absolutely critical. So when the baby is born with hypothyroidism, it could be because the mother is hypothyroid. There can be iodine deficiency. And iodine deficiency, we need to understand that is extremely common, like magnesium deficiency. But unfortunately, many, especially women, are taking calcium, which is, in my opinion, is a mistake. You should replace magnesium and vitamin D3 if you want to have enough calcium in the body. But many women take calcium tablets and drink a lot of soy products to increase their calcium levels. Iodine deficiency can result in creatine, that is children who are born with very low IQ, can cause in deaf and muteness, mutism, not mutation, and spasticity. This is a mistake. I'll correct it. Iodine replacement must be initiated in the first trimester, best is before pregnancy. Third trimester, that means the last 3 months, even if you correct, it does not decrease the risk of mental retardation. Okay, this is the urine level. This should, the lab reference, if you want to check the iodine level for doctors. Sorry, I forgot to put, it should be 40 to 90 micrograms in the blood. So the maternal role of thyroid hormone in the fetal brain development starts long before the onset of thyroid fetal function, because this thyroid gland that is developing in the fetus does not function early in pregnancy. The total dependence is on the mother. Fetal brain development is totally dependent on mother's thyroid hormone. If it is not corrected, then it can result in low intelligence. I don't want to use the word low IQ. I think it's a very cruel term. If you see that anyway, my apologies. So we can call it slow milestone. Thyroid hormone affects mostly the terminal stage of brain differentiation. That means synaptogenesis means the nerves communicate through junctions. Those are called synapses. So for this junction to develop well, you need thyroid hormones. And then the nerves that the nerve itself, the nerve growth itself depends on thyroid hormones. And the nerve has got a sheath called myelin that depends on thyroid hormones. And the nerve has to migrate so that, it does its function well. And all these functions depend on mother's thyroid hormone. So if this is not recognized, how on earth are we going to have healthy children? So there can be, as I mentioned, mental retardation, there can be deafness, there can be spasticity. There can also be ADD, autism, schizophrenia, reduced cognitive performance, intellectual impairment, and hearing loss. One common problem with children nowadays is ADHD. It's a hyperactive attention deficit disorder. The reason why, you see, adults, when we are tired, we have so many reasons. If we want to catch a nap, we are tired, we rest, we sleep. Unlike some who wants to keep themselves awake with coffee. But children, they don't like to waste their life. They want to be active. And they know that if they rest, they will feel sleepy because of hypothyroidism. So these children will become hyperactive. That's another clue. So hypothyroid women have higher risk of delivering children with impaired neurological development. So it's good to recognize if you do not understand, don't understand hypothyroidism at birth, then you will miss, and this can result in serious problems, especially if the child has severe hypothyroidism, can result in cretinism. That means children who have very, very, very low intellectual capacity. It's quite often you see a severely hypothyroid child, the mouth will be always open and the tongue will be outside because they also have large tongues. So they don't have, they find it difficult to keep it inside the mouth. So the tongue is always protruded, mouth is open. Small eyes, wrinkles at birth. Poor fellow is very worried. Jaundice, hyperbilirubinemia is one. Delayed skeletal maturation. That's one. Delayed liver maturation. So the baby's liver function can be slow, and that can also result in jaundice. And all this, if it is not recognized, then that can result in permanent mental retardation. Okay. So a baby with neonatal jaundice, please consider hypothyroidism. Besides other treatment, of course, traditionally, my mother used to make sure that we get sun exposure when we were small at birth. Soon after birth, this was a tradition. Now we have phototherapy, but hypothyroidism is the underlying cause, is one of the main causes. Big babies, I have some slides to show you umbilical hernia in the newborn, infections in the newborn because of the suppressed immune system, difficulty in breathing. Big babies, for Asian standards, anything above 3.5, you should consider as possible hypothyroidism. And don't stop here. Please investigate the mother. That's important as well. Okay. This is what I mentioned. Umbilical hernia at birth could be a sign of hypothyroidism in the newborn. Inguinal hernia, Of course, you can recognize sometimes puffy eyes, puffy face, and the baby will be hypotonicity, means flaccid, no tone, less tone. Breathing problems, I mentioned, congenital anomalies, infections. So a low tone baby. So they will have flaccidity. And this is the reason why they also have congenital dislocation of the hip. I have, I don't call them as dogs. Of course, if I say children, you all won't understand who I am referring to. I have 3 of them. The last one was my first, and the third one, they're just common breeds. And this is the last one is a male. And we had he had dislocated hips, and when I saw the vet, he advised me after 6 months, close to a year, if it doesn't get corrected, we'll have to do a hip replacement. But of course, I didn't, I don't know how to recognize hypothyroidism in them, in pets. But anyway, what we did was oil massage twice a day, and now he's perfectly normal. He's about a year old now. So anyway, I was mentioning about congenital hip dislocation. So consider hypothyroidism. So when babies are born, this is a standard test that we do. We just open and abduct the thighs to see whether it comes out the joint. So why we do is to diagnose CDH, or congenital dislocation of the hips, but we were not told at that time that it is probably due to hypothyroidism. Okay, so the babies can be born with a little bit of bigger size head. This is not common. Jaundice is common. Large tongue, I mentioned. They cry less. They can cry less, sleep more, and very lethargic. Okay. Constipation could be a presentation. Okay. Water in the genitals called hydrocele. Hypothyroidism. Okay. Low heart rate. Non-specific symptoms of hypothyroidism, they can have difficulty in sucking the mother's nipple. And I believe it could be because they just don't have the energy, because hypothyroid children have low energy like adults. Constipation. Okay. And large anterior and posterior fontanelles. If you run your fingers on the scalp, newborns, you can feel 2 gaps in the front and the back. They are called fontanelles, where the bones meet the joint. So if there is a delay in these fontanelles from closing, that could be a sign of hypothyroidism. So we move on to the next stage of life, children with hypothyroidism. So unfortunately, it's if the neonate or hypothyroidism at birth is not recognized, at least it's not too late to recognize at this age. So they suffer frequent infections, especially because of suppressed immune system, and they can have slow milestones. So they are poor performers in school. I just remember a teacher, Tamil school teacher. If she's here, she can say a few words at the end of it. The name is Gunavali. If she's doesn't have any hesitations, usually she joins. Now she had one son. Now I think close to about 18 years. Now that boy has some problems with the hips and the spine. But anyway, he's much better now. But subsequently, what happened was she was not able to conceive for many years. And when I corrected her hypothyroidism, then she went on to conceive, and she has 2 other sons. And both these fellows, they are very intelligent, very smart children. So, just hypothyroidism, it doesn't cost much to treat hypothyroidism. But that can bring so much of happiness for the parents. And children can have flat feet, very common. You see the loss of arch. Yeah, it's so common, but very seldom recognized, like loss of arch. So these children, when they grow into adults, they'll have a lot of problems with this joint, these joints, and also their hips and their back and possibly spine. Another classical sign is hyperreflexity, laxity. So they can stretch. But of course, you know, if you train yourself well from young, you can't say this is hypothyroidism. Maybe this girl practices yoga from very young age. So don't go around labeling everybody who stretches like this as hypothyroid. Yeah. This boy, I mentioned about muscle pain. So this was a very interesting case. 8 years, and his only problem was muscle pain at night and cannot sleep because of the pain. And for many years, of course, they have tried many kinds of treatments. So I told the mother it could be low thyroid hormone, so let's check. And when I did the blood test, he was hypothyroid. And once we corrected, he could sleep until he can snore. So imagine if you don't recognize this child ends up as hypothyroid even in adulthood. This is another sad case. The mother had history of thyrotoxicosis. That means excessive thyroid hormone, which is usually an autoimmune disease caused by gluten. Unfortunately, she was given radioactive iodine. To me, it's a cruel treatment. This is what happens. This is what happens when you don't understand what causes the disease. Sometimes we make very wrong decisions, and that results in lifelong problem for the mothers. So she became hypothyroid and then she managed to conceive. The second child, after the first child, she had thyrotoxicosis, and subsequently after delivery, she was given radioactive iodine. Then she had a second child, and this child was always sick, frequent hospital admissions. And when she brought to me, she told me this history, and I checked this. Son, hypothyroid. Once you correct, they are so much better. And of course, I always tell them, make sure these children play out in the sun and make their own vitamin D, but I give them vitamin C as well. Hypothyroid children can have poor school performance. I mentioned autism can be increased in hypothyroid children. No point just building special schools. Of course, they are necessary if needed, but the root cause must be understood. It is often seen, or it is seen with modern diet, and I believe it's mostly because of gluten and possibly sugar, causing leaky gut syndrome. Hypothyroidism is one, and there are many studies that show there is a link between vaccinations and autism. You can have, now these pictures are from a book called Physical Degeneration by Weston Price. Anybody who's interested in starting this journey, that would be a very good book to start. He made his journey as a British dentist. He closed his clinic, went around the world, wanted to look at the difference between native children eating native diet and even native children eating Western diet. And he can see a lot of degeneration, especially in the oral cavity. Children with nice teeth, very well formed jawbone, okay? Small jawbones, horrible teeth, you see, all these deformities. So one of the reasons is hypothyroidism. Now, gluten affects thyroid function because it causes autoimmune thyroid destruction. And so anybody who wants to prevent not only thyroid problem, you want to live healthy, you have to understand that gluten is toxic, sugar is toxic, dairy products are toxic. So this is another picture to show you dental deformation, but of course we have lots of treatment for all this, but the root cause must still be recognized. Okay, enlarged tonsils, brittle nails. Yeah, especially in older children. Severe case of hypothyroidism, what happens when you correct? So if you miss the first stage, if you miss the second stage, at least we should pick it up at this stage. But it's important for parents to understand. Yeah, that's why I want the public to attend. Reduced scalp hair in adolescents, reduced axillary and pubic hair, not so common, but can happen. Hyperlaxity, flat feet, I've shown. Kyphosis and scoliosis, spine deformities. One is kyphosis, bending forward, and the scoliosis is like a S-shaped spine. And if you don't recognize, it just gets worse until a surgery is done. You know, there are children who have spinal surgeries for these problems. They often have short stature, sometimes they're tall. Wobbly gait is quite common. They have pale look. Of course, they have cold extremities and poor school performance. Very important to recognize this in young girls, delayed menses. The usual age for menses, first menses is 12 to 14. But very often, now what we see is very early menarche by the time they reach 8 years, 9 years. And this is abnormal because they get too much of estrogen from chicken and meat, who these animals are fed with estrogen for rapid growth, a lot of soy products, dairy products, plenty of estrogen. So these girls, they have early menarche, but if they have hypothyroidism, then the menses can be delayed and they have scanty flow. Scanty flow is a classical sign of low thyroid hormone. And once they have menses, then they may not have menses for 6 months, a year after that. And hypothyroidism can present as cysts in the breast and ovaries. But please remember, hypothyroidism with iodine deficiency can also cause cysts in the kidneys, in the liver as well, and in the thyroid as well. Children can be obese, but not only thyroid nowadays, it's a mess. The dietary habit is a mess. We eat too much of refined foods, too much of fast foods, and these children eat late at night. Sugar, dairy products. It's very sad. And these children are often lazy. So how do you treat? For the infants, usually a test is done with the umbilical cord. We usually check the TSH as well as the T3 and T4, but sometimes it's a bit difficult to pick up because the T3, T4 can be elevated for up to 7 days because of the mother's thyroid hormone in the fetus. And so you'll have to have a repeat, and it's always good to repeat. If any indication, if you suspect, it's good to repeat. Okay. And then the T3 in the baby, newborn baby, continues to increase, and the reverse T3. In the first lecture, I mentioned to you that the placenta has more reverse T3 supplying to the fetus. So this actually decreases. So for the newborn, if the thyroid hormones are low, then you can give thyroxine. Now, thyroxine is just T4. The compounded ones have T3 and T4. It's always better to use a combination of both T3 and T4, but this is difficult to compound for newborns, and you may not get it immediately. But thyroxine, which is very freely available in the pharmacy, the dose is 10 to 15 micrograms per kilogram per day. You can also have thyroid extracts called glandular thyroid. So that means the thyroid gland is and an extract is prepared, which is available now. We have Armour thyroid, and these are all glandular extracts, and the dose for newborns will be 2.5 milligrams. So it's always good to replace both T3 and T4. often the prescription from hospitals or by doctors is thyroxine, which is just T4. So in the body, T4 has to be converted to T3, which is the active hormone. And T3 is 10 times more potent than T4. So as you age, our ability to convert T4 to T3 may get reduced. So it's better to take T3 and T4 as a compounded formulation. Of course, it's a bit more expensive than thyroxine. Or at least take the glandular thyroid, which has T4, T3, and T2, and the whole glandular extract. So it's important to recognize this because sometimes if you take only thyroxine, you may not get all the benefits. But the treatment must also include nutrients that will help to improve the thyroid gland function. You see, when you diagnose someone with hypothyroidism, the idea is to replace the thyroid hormone, but we should also change the diet, avoid gluten, treat the leaky gut syndrome, and correct the nutrient deficiencies, which will help the thyroid gland to function and continue to produce some hormone. If it may not be optimum, you still have to correct it mostly. So it's important to understand. So there are some actually, especially minerals, which are very important. Selenium is very important for the activation of T4 to T3. Iodine is very important for the manufacture or synthesis of thyroxine, which is T4. If you want thyroid gland to produce your thyroxine, which is T4, you need 4 atoms of iodine. And iodine deficiency is extremely common. We also need zinc. Magnesium deficiency. Magnesium is a very interesting mineral because it does so many functions in the body. And if you optimize the magnesium level in the body, patients will require less thyroid hormones. With magnesium deficiency, you will need a much higher dose. Correct B vitamins. Iron also is important. Iron deficiency can cause hypothyroidism. Look at vitamin A deficiency, which causes hypothyroidism and follicular skin, like I mentioned, the rough skin. Correct growth hormone deficiency. Now, growth hormone, testosterone, they boost the thyroid gland. So it's always good to check the rest of the hormones if possible and correct the rest of the hormones as well because they work in synergy. The other hormone that need to be balanced is the cortisol. So cortisol is from the adrenal gland. It's the anti-stress hormone. If you are deficient, then you have you always wake up feeling tired in the morning and after lunch. You have a restless mind. You are anxious. You worry a lot, and you are moody. You are irritable. You can lack focus and attention. So all these are features of low cortisol, and usually adrenal dysfunction and thyroid dysfunction coexist. So it's good to check the other hormones as well. So if you have thyroid glandular extract, you can, that's known as desiccated thyroid. 1 gram is equivalent to 1 gram of desiccated thyroid is 60 milligrams. So average dose is 60 to 90 to be taken like thyroid hormones in an empty stomach. But children actually may require higher dose because they are active. Less than 3 years, the standard dose is 3 to 7.5. Always start at a lower dose. 3 years is 30 milligrams. 6 years is 60 milligrams. And adolescents will take adult dose of 60 to 90 milligrams. If you have reverse T3, which I discussed in the first lecture, reverse T3 occupies the T3 receptors and block your T3 from working. And stress and other reasons increases reverse T3. But then reverse T3 means if somebody is diagnosed as hypothyroidism and your doctor corrects your hypothyroidism even with optimum dose, you still have the symptoms of hypothyroidism, it could be because of reverse T3. And how do you release is, how do you treat this is, usually you'll have to correct the cortisol. I mentioned just now, cortisol hormone, your doctor can check and correct, but you need slow release T3. And so the dose is you give 7.5 microgram every 12 hours, and you keep increasing every 2 days until the temperature, body temperature is optimum, and then you start to cut back. Doctors who are trained in thyroid hormones, they'll be able to do this. Yeah. So for T4 to T3 conversion, you need to make sure you have adequate growth hormone, testosterone, melatonin, insulin, and especially vitamins A, B12, and E. Minerals are also very important: iodine, selenium, iron, zinc, and copper. Let me remind you that copper is not a mineral like calcium that one should take regularly. Iron, copper, and calcium should not be taken regularly unless there is proven deficiency. High protein diet can actually decrease your T4, T3 conversion. So you'll have to have a balanced diet. Cortisol deficiency, so you'll have to monitor the cortisol, check and balance the cortisol deficiency. If you use growth hormone, then of course you may have to reduce their thyroid hormones. Iodine, the daily requirement, we don't follow the RDA. It's usually 1,000 to 1,500 micrograms. RDA can be as little as 150 micrograms. In pregnancy and lactation, you can increase the dose to 2,000. Children, they need a smaller dose, 20 to 120 micrograms, and including infants, much smaller. Other forms of treatment, herbs can be of help. Kelp, seaweed, ashwagandha, coconut oil. This can be of they can be of help. Avoid gluten. Avoid soy. Fermented soy like tempeh is okay. Fluoridated water, fluorine and chlorine are also halogens. So they actually, when you have excess, or if you drink fluoridated water, you're going to get fluoride too much in the body anyway. So what will happen is it will not allow the iodine to be used by the body. So it can create a pseudo iodine deficiency, even if you're on iodine. So it's better to avoid fluoridated water, but unfortunately in Malaysia, water is still fluoridated. Avoid fluoridated toothpaste. Please understand this, especially for pregnant women and children. No, if fluoridated toothpaste can strengthen the teeth and the enamel, then you won't have children queuing up in dental clinics. Fluoridated toothpaste is bad news. Okay. Now that's the spectrum of hypothyroidism across all stages: adults, infants, children, adolescents. So we have a lot of time for questions. I would encourage the public to also ask questions.
Dato', we have a question from Miss Grace. Dato', somebody with hypothyroidism and thin hair, could their hair grow normal again if thyroid hormones are corrected?
Very likely, but also remember this, not often, it's not common, but sometimes when you correct your hypothyroidism, you will have experienced hair loss first. The reason is because probably you're getting rid of the old hair, and then the new hair will start to grow. But generally, it improves hair growth.
Okay, the next question is from Ms. Pushpa. Her question is, what are the lab values for children?
The T4 levels are the same. The T3 levels will be up to 9.5, the upper limit, instead of 6.5 for adults.
From Miss Idawati, if soybean is not good, how about kidney bean and almond?
Almond milk is okay, provided it's not sweetened with sugar. Almond milk is fine.
Kidney bean, Datuk?
Kidney bean, I'm not sure.
Okay. Datuk, from Miss Pushpa, what type of magnesium, please?
At the moment, what I'm taking is a mixture of magnesium. It's a mixture of glycinate, citrate, malate, and there could be a little bit of oxide. Oxide is not the best way to take. If you are taking only magnesium oxide, if it is in the combination, it's okay. But a lot of confusion is in the form of the chelated minerals. But the magnesium, glycinate, citrate, and malate, they appear to have better absorption than oxide. So if you take a combination, it's better.
Okay.
But able to find a liposomal magnesium, that would be. Then the chelated mineral, whether it's oxide or citrate or malate, or it doesn't matter, because that's the beauty of liposomal preparations.
Okay. Datuk, from Miss Rani, can a subclinical thyroid patient be a thin person?
If I mentioned to you just now that hypothyroidism often coexists with hypoadrenalism, that means low adrenal hormones, especially cortisol and DHEA. So if the cortisol deficiency is quite profound, then it will result, you'll see someone who's thin despite having a very good appetite and eating a lot. So, and these are people who will have, who will be anxious and who will be moody and irritable, and they tend to be introvert. They are not extroverts, and they have less friends, and probably they'll even end up, even the marital life can be a problem with cortisol deficiency. So it often coexists with low thyroid hormone. So in that case, they can be thin, even though one is hypothyroid.
Okay. Datuk, from Macarenia Fuadi, when is the right time to consume iodine? Is it at day or night, before or after meal?
Iodine should be taken with meal, but I don't think there is a preferential time. You should be able to take any time. I think so. You can take it any time of the day.
Okay. Datuk, from Dr. Sankey, Datuk, which is the best between desiccated thyroid and compounded T3 and T4?
Desiccated thyroid is fine, because this was the only preparation available those days and still works very well. And it's a complete thyroid preparation, but it's not suitable for some religion. The other one is availability. It's not free, easily available in many countries. And the third could be the cost factor. It is expensive. For all practical purposes, T3 and T4 compounded, they are fine. They work just as well.
Okay. Datuk, from Mr. Anbar, are there any side effects when taking T3 and T4 medication, such as effects on the heart?
Okay. Whenever we treat hypothyroidism, the formula that I use is 1 in 4. That means the combination of T4, T3 will be 1 in 4. And this is the ratio, and I use the dose at 0.75 grains. And usually this is sufficient for adults. Sometimes I have to increase to 1 or 1.5. If I have to increase to 1.5 and beyond, I will definitely look into all other reasons why they require so much dose. So either they have high values of reverse T3, which your doctor can check, but of course it's expensive. Or they could have uncorrected cortisol deficiency, or they may require more magnesium and iodine often, and some B vitamins. These are the reasons why one requires higher dose. But at any time when you treat hypothyroidism, it's always good to start at the lower dose. And we have to tell the patients that if they have optimum dose, they are getting the correct dose, what will be the features will be, they feel warm, they'll sweat when they exercise, they definitely will enjoy more energy, better focus, and a lot of things will change. They will start losing weight if they're obese. But if the dose is too much for them, then they will feel too warm, too sweaty, headaches, difficult to sleep, and sometimes palpitation, rapid heartbeat. This is because of excessive correction. So we as doctors, we have to tell the patients, if you experience these symptoms, that means this dose is best for you. It is not a side effect of thyroid hormones, but the dose is too much for you. So just stop. It will few weeks, few days to a week or two, because the half-life of T4 is 2 weeks. So it may take up to 2 weeks for the symptoms to slowly come down, disappear. As long as you warn the patient and reassure them, if they call you, then nothing to worry about. It's not going to result in any major problem. After that, then they'll experience the cold intolerance, cold hands and cold feet again. At that time, you introduce a lower dose.
Okay. Datuk, from Mr. Kamalakanan, babies with umbilical hernia, if treated with thyroxine, will the umbilical hernia improve?
It may not, because it's a defect already at birth. So they may require surgical treatment, but at least it won't get worse. But the problem is not just that. It's if this is not recognized, a surgery is not going to correct hypothyroidism in the infants. We must remember this. The surgery is still going to leave the hypothyroidism in the body, and the child will have other problems.
Dato, from Dr. Navdeep, Dato, if say a patient comes with low or suboptimal FT4, but FT3 level is optimal and TSH is 2 and below, what is the approach in this case?
TSH and below does not necessarily rule out hypothyroidism. I mentioned earlier hyperthyroidism. It can be because of treatment. It could be because of a poor response from the pituitary. I mentioned all the reasons before. Now, what do you do in such cases is you have two choices. T3 is normal, optimum, T4 is low. Some of these patients may not have any symptoms of hypothyroidism. Now you will have to tell the patient that I am a clinician. I have to treat you not only the blood results, but in this case, your T4 is low, but you have no symptoms. So I'm not going to give you thyroid hormones because you will be experiencing thyroid toxicosis symptoms, too much thyroid hormones. However, at any time, if you feel that you have thyroid, hypothyroid symptoms later on in life, you need to come back. That's one. Number two, just give them iodine. Maybe they'll produce more T4. Okay. Number three, if they have symptoms, then you have two choices. One is just give them thyroxine because only T4 is low. But what I do in my clinical practice is, even if the T3 is normal, if they have signs and symptoms of hypothyroidism, I give them T3 and T4, the same dose, 1 in 4, 0.75 grains. But I'll make sure they understand, I'll write this in their report, a copy of which is given to them, that if they experience heat intolerance or excessive sweating, headaches, difficulty to sleep, or heart beating fast, then they must stop.
From Miss Natasha, Dato, what is the best suggested treatment for a person with high allergy?
What allergy?
High allergy.
Oh,
yeah.
It's good to find out what you're allergic to. Okay, if it is food, A very easy way to do is you challenge, food challenging. That means, say you suspect eggs, you know, the common foods can be seafood, eggs, dairy products. Anything that you suspect, you take it away from your meals, from your diet, total avoidance for 2 to 3 weeks. Then you have to challenge that food after that. And if you're allergic to, you'll pick up. So you'll have to do one by one. That's one. And of course, you can have allergies due to low thyroid hormones, low vitamin C, low vitamin D3, low glutathione, low magnesium. You can also have low selenium also. Another common reason is if you have gut dysbiosis, and especially if you have candidiasis. Okay. Now, what I thought is we need to talk about candidiasis, and I'll explain you why. Because it's extremely common. It is more common, probably as common as hypothyroidism or more common, and it's extremely poorly understood, under-recognized, and the treatment is hardly ever given, but the presentations can be in the gut and can be outside the gut in terms of allergies and eczemas, autoimmune disease and psoriasis. It's again a very long list. And because of high carbohydrate diet, antibiotics, and poor breastfeeding, and so it's extremely common, all ages, and widespread use of antibiotics. So maybe the next time we can discuss candidiasis. But again, I will have to split it into part 1 and part 2. And I would also like to urge the participants to consider that we may impose a small fee. We are trying to do without it. It's just to cover the expenses, because it's not, Zoom costs money, running an office with admin staff, it costs money. So sometimes we are able to manage, sometimes we need to charge a nominal fee. We haven't decided yet. But anyway, that I'm sure most of you all will be able to afford education. When I used to study, when I started this journey, every conference I used to spend about 15,000, 20,000 those days, because so expensive. We need to travel overseas. So we try not to, but if necessary, we will charge a small fee. But the topic can be candidiasis. So if you have candida in the gut, if you have food allergy, if you have poor immune system, you can have allergies. So it's a little bit difficult. So it's good to start with the healthy diet, whatever we spoke about. Take some immune boosters, vitamin C, vitamin D, glutathione, and magnesium. And if possible, see a doctor who can work on the hormones and correct all the pillars of health. And it will definitely go away without having to take anti-allergens and all that, antihistamines.
Dato, from Mr. Liao, for a normal healthy person, what is the daily magnesium supplement volume for adult and child?
Adults can take 500 milligrams daily, but very often we require 500 milligrams twice a day. I have patients who need to take even 3 times a day. I take magnesium 3 times a day, and when I wanted to know how many magnesium is too much for me, I have to take 6 capsules of 500 milligram each before I had diarrhea. That's because, of course, if you sweat a lot, then you may have to increase the dose, but generally daily to twice a day is sufficient, sometimes 3 times a day of 500 milligrams.
Dato, are cruciferous vegetable absolutely contraindicated in thyroid diseases?
Actually, cabbage and other forms, of course, they are goitrogens in excess. But when you take cruciferous vegetables, they are extracts, and I don't think they have so much of problems on the thyroid.
Okay. Dato, from Q Chen, which heavy metal or metals toxicity causes significant hypothyroidism? Which heavy metal toxicity?
Mercury, aluminum more for brain. Mercury, yes. But then all these heavy metals like mercury and aluminum, will hear about safety limit, safety level. There is no safety level because no amount is safe for us. So even if there is a tiny amount as seen as in the vaccines, and almost all the vaccines, I think all the vaccines, you have either mercury or aluminum. So no amount is safe. But I think mercury will have an effect on thyroid.
Dato from Dr. Kanan, if T4 free T4 is normal and free T3 is low, TSH normal, no symptom of hyperthyroidism, should we treat or leave them alone and review the blood test in 2 months?
Okay, if there are no symptoms, okay, so you understand all the symptoms, you ask them. The classical symptoms, ask them first. Do they have cold intolerance, cold hands and cold feet and sallow appearance, and they don't sweat much and they are tired in the morning? And so those are the things that are classical. If they don't have, don't treat, because you have to be a clinician first. So you treat the patient, not only the blood results, but tell them to eat a healthy diet, practice healthy lifestyle. And at any time, if they have signs and symptoms of hypothyroidism, come back and you treat. And it's not necessary to repeat the blood test in 2 months' time. You can do 6 months, a year, because you have already advised the patient to come back if they experience symptoms.
Okay. Okay, Datuk, from Dr. Celine, what would be the appropriate schedule in monitoring levels for TSH and FT3 if on thyroid hormone replacement therapy?
Okay, in my practice, I don't repeat the blood test. What I do is I will make sure they are optimum just by eliciting simple questions, asking questions. You feel them, they will feel warm, and ask them about energy levels and sweating, ability to lose weight. That's optimum. So you don't have to repeat. If you want to, don't have to do too often. But once you start treating, do not look at TSH. This is another mistake that doctors make. When the TSH levels are suppressed, because once it's already been, treatment has been already started, they look at the TSH level and reduce the thyroid hormone, T3, T4. Don't do that. Once you have initiated the treatment, TSH usually does not have significant values. You don't have to even repeat. I don't repeat in my
Dato, also from her, what is the proper dosage for iodine supplementation and for how long, and if there's any monitoring needed?
You can do serum levels like what I mentioned, 40 to 90, or you can check the urine spot levels. Iodine, don't follow the RDA, which is like vitamin C and everything else. The intention is to keep you deficient and keep you sick. So this is the trade-off. The health is a trade-off for them to sell all these drugs. Optimum is 1,000 to 1,500 micrograms, and maybe you have to increase in pregnancy and lactation up to 2,000. And once you are iodine deficient, unless you can replace it with the cooking salt, iodized salt, organic iodized salt, and you may not require such a high dose. If you want to discontinue, please check your level. But otherwise, it can be taken for long term.
Datuk, from Dr. Sofian, since we need insulin to effectively convert T4 to T3, then being in a state of low blood sugar, especially for someone who has just started ketogenic diet and unaccustomed to using ketone bodies as a fuel, can overtax the hypothalamic pituitary adrenal HPA axis. In these circumstances, how we should overcome this condition?
Starvation, or when you go on low calorie diet, or you will have less conversion of T4 to T3. That's why you have the symptoms aggravated. And in this situation, your insulin level low. But low insulin can also have, so how do you correct the hypoglycemia? It's a matter of time before the body gets used to low blood sugar. So that ketosis will take over the rest of the problems. But usually if people are on borderline hypothyroidism, not picked up earlier, they will present with classical symptoms of hypothyroidism when they change the diet to a keto diet or low calorie diet. At this point in time, you need to correct. Another reason why low insulin aggravates hypothyroidism is insulin is a hormone that is critical for health and life. If you have no insulin and insulin is not replaced, we cannot live, because insulin is critical for glucose to enter the cell. But it's just not the glucose. It is also necessary for magnesium and potassium to enter, as well as amino acids. So if you see diabetic patients later on in life, long-standing diabetics, end stages, they start losing muscle because they don't make muscles. They cannot have amino acids going into the cell. But they also have higher complications of hypertension, heart attack, and stroke, and they usually have cramps and muscle twitchings and all those. These are because of magnesium and potassium deficiency. They also need insulin to take them into the cell. So if you have low insulin, you could become temporarily deficient in this as long as you're on this diet. So it's better to watch. If you have too much insulin and if you have developed insulin resistance, you'll have the same problem, because the insulin is not able to do its work. So all in all, if you're on keto diet, if because of low insulin, or even if it is not because of insulin, you could experience signs and symptoms of hypothyroidism. So it's good to supplement.
Okay. Datuk, from Miss Lata, is the treatment lifelong for both hypo and hyper once diagnosed?
Good question. Hyperthyroidism is reversible. It's totally reversible. You do not need radioactive iodine. You don't need surgery unless it's, of course, malignancy or cancer. And you do not need anti-thyroid drugs. I have not used anti-thyroid drugs. The only thing you need to do is this: take the gluten away from the diet. And I promise you, when you repeat the blood test in 4 to 6 weeks time, the thyroid hormones will start to come down. You don't have to even wait for the results. After a week or so, the patient themselves will experience a reduction in the heart rate, palpitation, and they'll feel less warm and less sweaty, and they'll become less irritable. They sleep better. This will be there in 1 to 2 weeks time. But the hormones, high hormone levels will start dropping. Even if you have thyroid antibodies, after 3 to 6 months, they don't come down very fast. You can see a reduction. And the beautiful thing is, if someone has goiter, enlarged thyroid and thyrotoxicosis, even that enlargement will start to shrink, provided you remove gluten. And because autoimmune disease is also because of leaky gut syndrome, you have to know what other factors lead to this. So the common root causes are gluten, of course, is the primary cause. Sugar worsens it, dairy products worsens it, and presence of fungus in the gut, which usually presents as gastritis, bloating, reflux, or eczema, or for women, vaginal candidiasis or psoriasis, autoimmune diseases, that has to be treated. Now, if you address all this, and also remember the hormone cortisol that I mentioned from the adrenal gland is it acts as a damper for thyroid. So if somebody has got high thyroid hormone, the way to knock this off quickly is to replace cortisol deficiency. Once you give cortisol, hydrocortisone, the thyroid hormone overactivity will get less. So is thyrotoxicosis reversible? Yes. Thyroid hormones need to be replaced for long term? Yes. Because it's difficult to find, to optimize thyroid function once you stop taking, even with lifestyle changes. But if you take enough magnesium, If you have AMPK and if you have niacin, vitamin B3, you may have to take a very small dose, or you may not have to take thyroid hormones on a daily basis, because it will improve metabolism. You'll feel warm, you'll sweat, every other benefits of thyroid hormones there, provided you have optimum of these three: magnesium, AMPK, and niacin or vitamin B3. Otherwise, it's long term and it's absolutely safe. If it is safe in pregnancy, then it should be safe for all stages of life. And what does it do in pregnancy? Everything good, nothing bad, except if you overtreat. Because you have healthy pregnancy, you have an healthy baby. So it's not wrong to continue that for long term.
Okay, Dato, from Miss Rani, some lab doesn't provide saliva cortisol level. So is blood cortisol sufficient?
I use only blood levels. I am quite happy. So it's sufficient enough. And Kamala Kannan has got a question, Dr. Kamala Kannan. Where can he get AMPK? My AMPK is from Life Extension.
Okay. Dato, would you like to take more questions?
I'm okay, provided you are okay.
Okay. From Dr. Sofyan, how significant is the effect of systemic low-grade inflammation to the conversion effectiveness of T4 to T3?
I'm not so sure to give you a percentage, but then, Sofyan, chronic inflammation due to various causes. It can be because of high blood sugar, high insulin levels. It can be because of gut dysbiosis. It can be because of heavy metals. They all cause chronic silent inflammation. I call it CSI. You know, you would have watched the American drama CSI. This is a different CSI, okay? Now, chronic silent inflammation is the root cause of almost all known diseases in us. So usually you will pick it up by checking your ESR or CRP. So if it affects T4 to T3 conversion, I haven't come across any article, but I believe it should have, because anything that is causing chronic inflammation affects many functions in the body.
Okay. Dato, we will take question from Dr. Sankey. In your practice, do you test urine iodine or iodine loading tests?
Okay, usually I don't test. I go by what the statistics tell me, because iodine deficiency is so common. So how do I decide somebody needs iron? Is I consider very strongly in pregnancy. I will definitely give iodine if somebody has cysts in the thyroid, liver and kidneys, or women who have breast variances, unless the cyst is endometriotic. And if I have to use more than 0.75 grains of iron, T3, T4, then it makes sense to replace iodine. But of course, if you can check, please go ahead and check spot urine or serum levels.
Dato, from Miss VN, which thyroid product can you suggest?
You mean in Malaysia?
I guess so, Dato.
Okay, there are many compounding pharmacies. You have Hegel, you have Aurelia, and yeah, these are the two companies that I use. But of course, we should be very thankful for Aurelia for sponsoring this talk.
Yes, Dato. We can take another question from Dr. Sofyan. In your opinion, how robust does the impact of boosting mitochondrial function for improving adrenal and thyroid function?
Thyroid function, yes, Sophia. That's how your magnesium and niacin works, because they improve the mitochondrial function, ATP and energy levels. But I'm not so sure about whether it can improve adrenal function as well as thyroid function. From what I've seen, you still need to take the adrenal hormones.
Datuk, he also asked, will there be any side effect of long-term use of bioidentical thyroid hormone restoration therapy to our endogenous mechanism of positive and negative feedback loop?
Hormones, when you take, of course, you have the loop back, feedback loop. That will be, not to say they are disrupted, but they become quiet. But again, you have to weigh the balance. So if you don't, then you live with low hormone levels, which is, so if you take, then if you are concerned about the feedback loop, then you can cycle. You can take Monday to Friday, stop Saturday, Sunday. You can take 3 weeks and you stop for a week, or you take 25 days and stop for 5 days. So that's where you can, if you cycle, then at least you don't make the body lazy. It still remembers what to do.
Datuk, we'll take another 3 more questions from doctors. So Dr. Sankey, do you use tablet iodine or Lugol solution or Gersol's Lugol solution?
Lugos used to be the standard treatment, but now it's difficult to get, because in Malaysia, I think the only ones who compound are the hospitals, government hospitals. So I have both the capsule and the liquid form.
Datuk, from Dr. Navdeep, how commonly do you come across patients who require to do the RT3 test?
What is that?
RT3 test.
Oh, reverse T3 test. Not often. If you get a patient who have all the signs and symptoms of hypothyroidism and with proven results, but your treatment does not bring in results, that means the patient remains hypothyroid and your blood results show an optimum level of T4 and T3. That means you have normalized the blood results, but the patient remains hypothyroid, then please consider reverse T3.
And from Dr. Kamala Kannan, can ED be one of the cause of hypothyroidism?
Can?
From Grace, Datuk, how long can somebody take T3, T4 therapy after the thyroid hormones are stable?
If you stop, then of course you are going to be hypothyroid. You are only as stable as long as you take. That's what you.
Okay. Last question, Datuk, from Dr. Celine. What is your stand on homeopathic remedies to activate receptors for hormones before starting BHRT?
I don't have experience, but what I can say from traditional treatments, okay, coming back to these receptors, if you improve the cell health and if you improve the cell membrane health through a lot of dietary manipulations and vitamins and minerals and detoxification and omega essential fatty acids, all those things are essential. So you improve the receptor function. But if you are low in hormones, you have a healthy docking system, but you still have low levels of hormones that dock onto the system. So you still be low, provided your thyroid hormones are also optimized. But from my experience, traditional treatment, Chinese, Indian treatment, homeopathic treatment, they are good to detox the body and for gut cleansing, sometimes to boost the immune system. From what I've noticed, as far as hormone deficiencies are concerned, you will need to replace them with hormones in most cases. Yeah, but if homeopathic treatment may gives you thyroid status, then go ahead. You don't need the thyroid hormones. What was the question from Dr. Kamalakan?
From Dr. Kamalakannan was, can ED be one of the cause of hypothyroidism?
Don't know what is EB or ED. What is that?
ED, Dato.
Erectile dysfunction?
That's what I thought, but I'm not so sure. Mr. Kamalakannan, can you text? I'm not so sure, Dato.
No. Erectile dysfunction is testosterone deficiency and nitric oxide deficiency, could be magnesium deficiency, but thyroid.
Yeah, Dato. He meant erectile dysfunction.
Okay, no. Testosterone, yes. Nitric oxide deficiency, yes. Magnesium as a vasodilator, yes. But not hypothyroidism as far as I know.
Okay. We are done with questions.
Thank you all. So see you all soon. Namaskara.